Thank you. Well, it's the top of the hour, so we'll get started and wish everyone a happy new year. Thank you for joining us today, a part of our GlomCon seminar transplant series. And with that, I'm going to turn it over to Dr. Rubin to introduce himself and Dr. Solez, our speaker today.
Okay, thank you, Dia. Welcome, everybody. I'm Mario Rubin. I'm substituting today for Dr. Safa, who had a family emergency, but he sends his regards to everybody. And as Dr. Waguespack said, a happy and healthy new year for everybody. This is a great way to start the new year by having who is considered to be the father of kidney transplant pathology, Dr. Kim Solez, present the topic of xenotransplantation. Dr. Solez, welcome and thank you for doing this.
Okay, great. So this is the ethics of pig-to-human transplants, artificial intelligence, and why the future is porcine. So disclosures, I have no financial disclosures, but politically there is something. As chair of the Banff Foundation, I pushed tissue engineering pathology as a logical future of transplant pathology starting in 2011. And actually in 2017, all the individual organ chairs agreed to start figuring out what tissue engineering pathology would look like for their individual organs. But now it looks like perhaps xenotransplantation will be a reality before stem cell generated organs, but I guess we can't be absolutely sure about that. Also, the two can be combined. You can imagine decellularized pig organ scaffolds, recellularized with human cells to create a functioning organ useful clinically, if one can overcome the problems of getting the right cells in the right places and creating long loops of Henle so you can concentrate the urine. So as many of you know, I work very closely with the best known AI person here in Edmonton, Rich Sutton. And his style of presenting is to give a slogan at the beginning. And his talks have just one slogan. You can see I have about 8 subjects here. But if I had to pick one, it's this idea that the rapid advance of artificial intelligence in the early part of 2023 applied to pig-to-human transplants is likely to be medicine's finest hour. And it will contain a lot of unusual activities that we do not have anything like from the past. So there's a very unusual feature of the time we are living in right now. And as a matter of fact, I started to document everything that's happening from January 3rd through to March 2nd, figuring that in that 60 days, GPT-4 will be released, we think. And so for any of you who are impressed with Chat GPT and what it can do, GPT-4 will be many orders of magnitude more accurate, more correct, faster, everything. And so it's really going to change human life for everybody, creating a massive increase in human creativity and scientific discovery, magnitude of discovery and number of discoveries as a consequence of AI advancement. And if you think about the challenges of pig-to-human transplants, that's exactly what we need, because right now today, we don't know that technique works, but we've been trying for a while. And the timing of my activities, in terms of my role in the AST as chair of the Transplant Regenerative Medicine Community of Practice, we are having a controversies conference in October 2023 about pigs, Putin, and pandemic, how these three potent factors have reshaped the hybrid future of transplantation.